I have psoriasis since 2007. Can prednisone help me? Okay, yes, prednisone can help psoriasis. The thing about psoriasis, though, is like, what is psoriasis? First of all, psoriasis is like a plaque, a skin condition where there's like a thickness, usually on the elbows, knees. It can be other places, but those are the most two common places. And this like thickness grows, and it's a change in the way the skin is working, and it can be painful, it can crack and bleed, it can potentially be itchy, and it doesn't look nice. Like, you don't want to be wearing a swimsuit and showing off that. Like, it's horrible. And so psoriasis can also lead to joint damage. So like, if you have a plaque here, you might get pain here or even in other joints. That's called psoriatic arthritis. And if that is happening, prednisone can definitely help with the arthritis. And it can potentially help with the plaques. But the hard thing about the plaques is they're so thick, there's so much happening that prednisone is often inadequate. And so they use creams and ointments and things instead. So like a topical clobetasol ointment applied there, or other medications in a cream usually work better than a pill because it's just so far from what the pill can do. Generally, the pill isn't the best method. So we want to minimize the damage by getting to the site of action. So like, if you have a rash, you want to apply a cream. If you have trouble breathing, you want to use an inhaler. If you have an eye issue, you want to use an eye drop, right? We want the drug to go right to where the action needs to happen. And a pill is often not the best strategy for psoriasis. Usually a cream directly onto the site of the problem is the best strategy. But there are so many other medications that can help with psoriasis that have a lot less side effects. So if a person has psoriasis, prednisone may help, but it also can cause so many side effects that it's just not worth it for a lot of people with psoriasis. Whereas there's a lot of other medications, injectables, and other things that can really help. They just tend to take a long time to really kick in. And so it's really frustrating because you're like, I've been on this $10,000 a month injectable medication for 3 months and I can't hardly see anything changing. And like, maybe it was like 6 inches of a wound lesion before, and now it's 5 inches, but it's hard to see those slow changes be worth it. And so I get it. Like, wouldn't prednisone be better? It's really a good question for your dermatologist or your rheumatologist or whatever doctor is treating you. But yes, psoriasis and prednisone have had a definite history, but I would bring it up with your doctor.